Okay. Orthopaedics.
It's handy.
I would normally like to introduce myself as an occupational therapist and say that like we specialise in hand and movement therapy. And so our role will be to get you back to, we mostly see workers' comp patients. So our role is mostly, most of the time I would say, to get you back to pre-injury level things at work. And so if you're doing normal things in day-to-day life, yeah. And so most of the time our way I kind of assess that and introduce myself that way is to ask them weekly like what they're having trouble with at work, and then what they're having trouble with like at home, and like what they're doing. So that kind of covers my like self-care, productivity, leisure, occupations, a shorter 6 questions for the patient. That makes sense. The way that occupational therapy is the best therapy in hands is because hands are used for your occupation. And I mean, the majority of your occupations you'll need your hands underneath to perform them to the ability to perform them in. And a lot of, I mean, obviously a lot of work requires hands, which we're the best at, we're the best trained in knowing what duties and what adaptations is part of our role as well. But educating people about conditions such as people who might be receptionists who do especially hairdressers who develop lots of like carpal tunnel or whatever things. But educating them about how to adapt their work roles, otherwise, they might be other 21-year-old patient who's got really bad bilateral carpal tunnel and deferred veins in both their hands, which is hairdressers, which is interesting. So they're very young and they're not at the point in their life where you're saying, oh, I just want to change jobs. So it's about having the psychology training that we've got and the knowledge that we have in ergonomics and in work adaptations that plays a role in hands, because it's about the nature of how they got their injuries, the OT's best, and then the adaptation at the end of it. The actual like anatomical perspective of it, what's anatomically wrong or what mechanical advantage this or that split has, can kind of be taught from OTs and but the reason OTs are best in this area is because the assessment of how they got the injury and then actually trying to figure out what other key factors in their life might contribute to them getting a flare up or injuring themselves again, and really creating a lot of occupational impedance is about where best.
I was involved in a bad motorbike accident a couple of years ago, and suffered quite significant injuries, including some bilateral femur fractures, bilateral wrist fractures, wedge fractures of L1 and L2 vertebrae, and then quite a lot of ligament damage in both knees. So yeah, so it was quite a rough time. To tell you the truth, I didn't know much about occupational therapists beforehand. It wasn't until about 3 weeks after I had the accident that the occupational therapist came and saw me when I was in Shenton Park Rehab Hospital, and described what they did, and told me how they were going to help me. So at that time, I thought any assistance and help would be good. So they worked really closely with my physios to get me up and out of bed after 4 weeks of not moving. So they did a really good job with things like using gutter crutches, walking frames, and all the way down to helping me work out a way of getting in and out of cars while I was still in a wheelchair. So yeah, it was one of those things that you don't really think about until you actually need to use them. So yeah, they went a long way for me. The OTs then went out to my house and assessed the doorways, and in case I needed things like ramps in doorways and rails in showers, and anything that was really going to make life easier for me. So yeah, it was really handy. from the time of the crash, I knew that my life was instantly going to be different and a lot harder. So I can see how occupational therapists do help out in every aspect of cases like mine and others as well.